The next abstract is Cognitive Functioning of Children HIV-Exposed and Infected, Preliminary Outcomes and Risk Factors by Julia Young from Canada, from the virtual presentation.
It's estimated that there are over 15 million children who are HIV-exposed, uninfected, or HEU children in the world. Antiretroviral therapies are highly effective at preventing the transmission of HIV from mother to child during pregnancy. However, in utero and perinatal exposure to ARVs and HIV poses risks to developmental outcomes in HEU children, some of which are increased prematurity, poor health outcomes, and psychosocial burdens. Recent meta-analyses have suggested that HEU children have poor developmental outcomes that include cognitive, language, and motor abilities. It still remains unclear whether exposure to ARVs during critical periods of brain development have detrimental effects on later neurodevelopment. Our study aimed to investigate neurodevelopmental abilities in HEU children in comparison to children who are HIV unexposed and uninfected, or HEU children during childhood. Our study is called the Kids Imaging and Neurocognitive Development Study, or KIND study, that is being conducted at SickKids Hospital in Toronto, Canada since January 2020. Our study is still underway and this data is preliminary. In this study, we included 36 HEU and 31 HEU children who are similar for demographic factors such as age, sex, language spoken at home, and maternal backgrounds. In addition, household income and maternal education levels were comparable between groups. The histograms here show the number of families in each income and maternal education level, with the HEU children in red and the HEU children in blue. Each child completed neurodevelopmental assessments that included intellectual measures from the Wechsler Intelligence Scale for Children, academic measures from the Wechsler Individual Achievement Test, and language measures from the Clinical Evaluation of Language Fundamentals. We performed t-tests to look at group differences between the HEU and HEU children. We found that the groups did not differ on any of the intellectual measures. These measures include overall IQ, fluid reasoning, processing speed, verbal comprehension, visual spatial abilities, and working memory. Now, as groups, they were generally performing in the average range based on Canadian norms. Similarly, no group differences were identified on academic measures or language measures. However, it's important to note that both groups demonstrated high variability in performance on all measures, and average math scores were also slightly lower than age expectations and likely impacted by the pandemic. Based on the assessments, we did see that 25% of the HEU children received a learning disability diagnosis, as compared to 3% in the HEU children. In addition, clinical recommendations of academic accommodations were offered for half of the HEU group, as compared to 23% in the HEU group. Analyses of covariance were included to look at the relation between income and education levels with the neurodevelopmental measures. The plots here illustrate those significant results. We're seeing a positive relationship between higher income levels and higher maternal education levels with intellectual and language abilities across both groups. In conclusion, HEU children perform similarly to HEU children of comparable sociodemographic backgrounds on assessments of intellectual functioning, academic abilities, and language skills from this interim analysis. However, sample sizes may be too small to detect differences right now. We also found that learning disabilities were more prevalent in the HEU group, and sociodemographic factors such as household income and maternal education levels were associated with intellectual and language functioning across both HEU and HEU groups, which highlights a critical need for mitigating these risk factors on child neurodevelopment. I'd like to acknowledge the KIND study team who were involved in this work. Thank you.